Super
very
good.
much. Thank you, doctor.
Ladies and gentlemen, welcome to yet another medical segment with Dr. Zahir Babar. I am your host, Omar, and we are joined today by the one and only Dr. Zahir. Thanks for coming back to the studios.
Thanks so much. It's my pleasure.
All right, so just to get everybody up to speed, last episode we spoke about what is alternative healing, what are the
Yes.
pros. Very quickly, for those who missed it, which they can still go back and check it out, but for those who missed it, very quickly, just get us up to speed. Again, what is alternative medicine or alternative healing, and why should people opt in for it as opposed to traditional medicine?
Okay. As I explained in my last episode, so briefly I can tell you the natural medicines have no side effects. In the other hands, the chemical medicine have so many side effects. So that's why always I guide to my patients, look after some natural way. So that's the brief answer, if I can say.
And I guess it kind of makes sense, right? Instead of bombarding your body with all these pharmaceutical,
Yes,
medical
yes.
drugs, chemicals, and so on, if you have the option to go natural,
Yes, of course.
why
yeah.
not opt in for it,
Yeah,
right? Okay.
yeah.
Now, from the first interview that we had, there's been quite a bit of response through the website, and we actually had a few questions that came in. So if you could help answer some of these, would be great. So we'll start with Sarah from Abu Dhabi, who actually writes and says, I've been suffering from heartburn and severe acid reflux for many years. My doctor told me that I need to have a gastroscopy procedure performed, but I'm afraid of the procedure. Can I avoid it by looking into alternative medicine, or is there another option that you can offer me to avoid the procedure?
First of all, thank you very much, Sarah. It's a very good questions. It's a very common question also. So many of my patients, they ask me because they're scared from going through the gastroscopy or something like that. It's, first of all, I want to tell her it's not a big clinical segment which you have to do. So don't worry, don't be panic. Follow your advice of your doctor, do this gastroscopy, and once it will diagnosis, and then you can come to me. And there are so many options in alternative medicines, so where I can definitely help you about acidity. So I can stop you taking the chemical medicine to this, but first we need to diagnose.
Right.
So follow the instruction of your doctor.
Okay.
But don't be panicked because it's not a big issue.
Right. Okay, and I guess that kind of makes sense because there could be so many different causes
Yes.
for acid reflux, right?
Yes.
Okay.
So that's why I would like if she follow the gastroscopy. So we need to know that probably she have some damage on her stomach or ulcer or something. So
Right.
first we need to diagnose.
Okay.
And then we will go to the therapy.
All right. Excellent. And is this something that you guys see quite a lot of? Have you guys helped people with this issue with acid reflux and been able to offer them alternative healing and permanently fix the
Yes, of
issue?
course. It takes some time because normally the patients come to the doctor when this acidity convert to the chronic disease. So
Okay.
that's why it will take a little bit time. But there are so many remedies which can help
Okay. Excellent.
without any side effects.
Great. Well, I hope that answers the question for you, Sarah. We'll move on next to Dana, who writes in from Sharjah. And she says, I've recently been diagnosed with fibromyalgia and was prescribed antidepressants and painkillers. However, I don't like how they make me feel and how they've affected me socially. Not to mention my fear of addiction to the painkillers. Are there alternative solutions for me? If so, what are they?
Yes, Dana. Thank you very much, Dana. First of all, your questions. There are so many solutions, so I cannot explain over in the interview because this disease, Dana can understand, it's related by the nervous system. So what happened in this disease, the patient basically increased his sensitivity. He became very sensitive, he or she. So there are so many remedies which can help her, but I cannot recommend her to leave the chemical medicine, which is antidepressive, very quickly, not in one day. So probably we need to make the plan. Gradually, she have to leave, but of course there are so many solutions in alternative medicine, so which can improve her symptoms, especially in nervous system and even the pain management. So there are so many solutions.
Okay.
She have to come.
Again, for those who don't know, including myself, what
Yeah.
exactly is fibromyalgia?
Fibromyalgia, we, like medical terms, we can say this disease is related with the anima. Anima, I say in Italian.
Sure.
Malattia di anima.
Okay.
So it's difficult to translate for me in English because I don't have a proper word for this. But it's related with the nervous system. Patient became very sensitive. For example, the same pain if you have, you will not feel. But the patient who suffer with the fibromyalgia, he will feel too much.
Right.
So basically, we have to work on his or her nervous system.
Okay.
So, but there are so many remedies.
So again, just for me in layman's
Yeah.
terms, essentially what this means is people are extra sensitive to any pain or anything else they might experience. It's amplified.
Yes,
to
it's
be a lot more
amplified, and the patient, quite often symptoms are that they feel lethargic, they feel very depressed, they don't want to do anything with the minimum thing, they feel so much fatigue. So this is the main symptoms, and sometimes they have a sleeping disorder also. So this is the common symptoms fibromyalgia patient suffer. So I work on the symptoms with the natural medicines, and so I have so many patients, especially in Europe, the young girls, they suffer this. So I have so many patients, and they have very good result in the alternative therapies.
All right, excellent. Well, Doctor, that's all the time we have for this short medical segment. And thank you very much for the time, and thanks for answering the questions. And that concludes our quick segment for today. Ladies and gentlemen, that was another short medical segment with Dr. Zahir Babar. Make sure you tune in to the next episode. Until then, this is your host, Omar. We'll see you next time. Doctor, thank you very much.
Thank you.
That was excellent. Do a handshake and keep talking. So.
For this one, for the last.
Yes.